Dr. David Jernigan is a national expert on substance abuse prevention advocacy. Although knowledgeable about all major substances, he is best known for his action research approach to the issue of alcohol advertising, marketing, and promotion and its influence on young people.
Hi, my name is David Jernigan. I'm a professor at the School of Public Health at Boston University, and I'm here today to talk to you about advocacy. Thank you for being part of this Advocacy Day. What you're doing today is so important, and it's important that we do it today and every day. I want to start by talking a little bit about what unites us. We hear so much of how divided we are as a country, but I think we can all agree that everyone should have the right to life, liberty, and the pursuit of happiness. That as part of this, we should all have equal access to the opportunity to be healthy throughout the course of our lives. There's a need to protect vulnerable groups, including young people, from being deprived of these rights. These common concerns are the basis for our common efforts. So what do we know at this point? Alcohol is the #1 mind-altering drug in the US among young people. Cannabis is #2. Tobacco is the most addictive drug we know. It kills in excess of 400,000 people a year in the US. Alcohol is the #2 killer, causes about 104,000 deaths a year, including nearly 3,000 in Georgia. We're in the midst of an opioid epidemic with 81,000 deaths from opioids over the 12 months that ended in May of 2020. And we're in the midst of the COVID-19 pandemic, and we anticipate a second wave of substance abuse problems that will follow on the pandemic and the poor coping patterns that people have used to deal with what's happened during the pandemic. When we look at Georgia, Georgia is missing some key things that are protective of health around alcohol and other drug problems. It doesn't have a comprehensive smoke-free law that protects people from secondhand smoke in all indoor areas, including workplaces, restaurants, and bars. It doesn't have a state law that holds people responsible for hosting parties where underage drinking occurs. And it hasn't increased its state tax on liquor since before 2003. The current liquor tax is the 37th lowest in the country, and if it had kept up with inflation just since 2003, it would be 43% higher today. Georgia also has the 50th lowest tobacco tax in the country. Those are a lot of specific things to talk to policymakers about. And when you talk to them just about those things in the way I just did it, you are not lobbying. You are simply educating policymakers, and this is an important part of what we do. Lobbying only starts when you ask them to do something about those facts. And again, what I'm talking about today is not lobbying. It's about educating your policymakers. They need to hear from you at the local and the state level. Your voice and your experience are unique and vital. Who needs to hear from you? Your state legislators still need to hear more from you. There are 21 days left in this legislation session. A lot of important business will still happen in the days ahead. And then your county commissioners, your mayors, your city councilors, they need to hear from you the whole rest of this year. So much of alcohol, tobacco, and other drug policy is made locally. You need to know what that local governance structure is and who the key decision makers are locally as well as statewide. Big changes are happening, and your leaders need to know what you think. So who are your leaders at the local level? There are 4 different kinds of local government in Georgia. There are strong mayor systems where there's a mayor in the city council and the mayor appoints most of the key heads of departments in that city. The city council is more of a deliberating and advisory body. And then there's the weak mayor, where the council has more power, but there's still a mayor and councilor. We also have council, city manager and council structure, where a lot of the administrative work is done by a city council, by a city manager, but the mayor and the council set a lot of the policies. And then finally, you have commissions in Georgia. And in commission, there's usually a lead commissioner, commission chair, or the mayor, and then other commissioners. Whatever your local structure of government is in Georgia, these are people who work for you. They need to hear from you. They're hearing a lot from the other side. In 2018, beer, wine, and liquor companies gave $915,000 to statewide candidates in Georgia. They need a balanced picture of what's happening in the state. You are the people who are best equipped to provide that balance because you're living these problems every day in your communities, in your schools, with your classmates, with your families, friends, and so on. So what do they need to hear from you? Well, a lot of you are just starting a relationship with them. Some already have relationships and you're now starting to take the next step. The most important thing to remember is to connect with them. They are people. You may be nervous. That's all right. They've been in that situation too. They know what it's like to be nervous. Don't worry about how you feel. The important thing is to connect with them as people. And some ways to do that are to try to be memorable to them, to come prepared with stories and with facts and a clear request, and to come prepared with memorable spokespeople. These can be young people, they can be people in recovery, they can be relatives of young people or people in recovery, people who have credibility simply because they've lived the experience they're talking about and they can help tell some of those stories. The Trust for America's Health has a really nice summary about how to make a difference. Number one, identify whom you want to persuade. That's what they call your target. And the more you know about them, the easier it will be to connect with them. Who's their family? What did they do before they served in office? What are ways that you can find pieces of commonality with them and connect with them? Next, you want to know your facts. What are the key pieces of information that help you make the strongest case possible? And then you want to begin to communicate, realizing that that policymaker will be listening the whole time for what your ask is. What do you want them to do? I'll talk about more about that in a couple of minutes. And then you advocate. And then after you've met with them, after you've spoken with them, you follow up. This is all about relationships. If you promise to send them something, send it within the next 24 hours. If you promise to follow up with a phone call, or you're going to get in touch with somebody and have them talk to them or broker a relationship or something, that follow-up is so important. It's what makes people trust us. It's so important to relationships. So making the argument, what are your facts? And the key facts are: how many people are dying? That's mortality. How many people are getting sick or injured? That's morbidity. What does it cost? What does it cost in terms of dollars to your city or town, or dollars in terms of the state of Georgia? And you can get a lot of this from the fact sheets that Voices for Prevention has given you. It's important to make some memorable comparisons, and I'll talk about that on the next slide. And then pictures are worth 1,000 words. So memorable comparisons, we have a lot of statistics in public health, and if you can make them graphic, if you can give concrete comparisons, they're sometimes much more striking. So for instance, in Atlanta, there are lots and lots of alcohol outlets. But it's more striking maybe to say there are 15 places to buy alcohol for every public high school in Atlanta. There are 26 places you can buy alcohol for every public library. If you want to break down some of the mortality figures, on average every day, 8 Georgians die of alcohol-related causes, 32 die from tobacco-related disease. I don't have the figures for cannabis deaths in Georgia, but Colorado, where they've already fully legalized, somebody dies in a marijuana-related traffic crash in Colorado every 2.5 days. Pictures can also just tell incredible stories. This is a big billboard for marijuana edibles, and it kind of tells the story itself in terms of the level of irresponsibility of this kind of advertising, but also if you allow billboard advertising for cannabis, it's the one form of advertising where you can't flip the page or turn it off. The next piece of making the argument, what are the policy options? Is what you're proposing effective? How do we know it's effective? What's the evidence? Does the public support it? Do you have any polling data, any editorials from local newspapers? Has there been news coverage of this? What about how broad is your coalition and how can you demonstrate support through who's a member of your coalition? Do you have any celebrities that have come out in favor of it? And then finally, is it feasible? Can it be done? Are there other comparable places that have done this? The next piece about making the argument is how we talk about it. And this is sometimes referred to as framing. Framing, one definition of that, these are labels the mind uses to find what it knows. And when we frame a political argument, we want to start at level one with values and symbols. These are what people care about the most. And then the general issue being addressed, and then details about it. That first level is so important. Level one is the values and symbols. They trump the facts themselves. So it's important to set those frames ourselves. What are the values and symbols people care about? We could brainstorm a list together, but here's one that I've used many places. Things that unite pretty much everybody in this country. Individualism, opportunity, free enterprise, freedom, competition, education, patriotism, motherhood, family, responsibility, empowerment, fairness, equity, protection of children and underdogs, generosity, human rights, self-determination, independence, self-reliance, trust, and good sportsmanship. So the components of your message, what's wrong? What's the problem? Why does it matter? What are those values statements? And what should we do about it? And one way to think about this is to try to put together what you're trying to pitch, what you're trying to communicate to a policymaker in 5 sentences. Your first sentence is the need. Your second 2 sentences are all about values. And your last 2 sentences are all solutions. So here's an example of those 5 sentences around underage drinking. Underage drinking is the #1 illegal drug problem among Georgia youth. While parents have the right to make decisions about their own children's alcohol use, they don't have the right to make those decisions for other people's children. Keeping young people safe is a community responsibility. Social host laws are tools for encouraging just that community responsibility. And the best version of them makes hosting underage drinking parties a civil offense with an immediate fine. And there's good evidence that these laws reduce underage drinking parties along with the nuisances and risks those can bring. So that's an example. Please make up your own, but it's a good idea to keep this kind of balance in mind. You want to talk about the need, you want to talk about those values that we all agree to as they apply to this specific issue, and then you want to talk about the solutions. And then you want to think about expanding those 5 sentences to a maximum of 3 minutes. That's usually about the most you're going to get with a policymaker. You want to make sure you include your story, who you are, why this matters to you, why they should remember you, your ask, what's the specific thing you want them to do, your key facts, how many died, how many are getting sick, and what are the costs, in addition to what you already put in your 5 sentences. What are we trying to communicate? Trying to communicate that prevention works, that treatment is important, but we also need to sufficiently fund and provide resources for prevention. We will never treat our way out of these problems. We have to move up the stream. We have to get ahead of them by doing prevention. And then much of what we do in prevention is programs, but those will work so much better if we have the right policies in place. So really the prescription for these problems is the policy, whether that's smoke-free laws or higher alcohol and tobacco taxes, more funding for prevention and statewide tobacco control programs, social host ordinances like I just talked about, communities having the right and communities making the decision to opt out of hosting cannabis dispensaries, and then that critical local issue of keeping the requirements that there be a certain amount of space between the placement of alcohol outlets or cannabis dispensaries and what we call sensitive land uses, things like schools, daycare centers, libraries, churches, playgrounds, places where young people and families are likely to be gathering. What is your ask? This is what they'll be listening for. What do you want them to do? And there's some soft asks. Take time to visit with substance abuse prevention providers and youth action teams in their district. Stay aware of and be educated about specific prevention needs and pending substance use prevention legislation. Take community substance abuse needs and related legislation seriously and act in response to what your constituents are telling you are the most pressing local and statewide substance abuse prevention needs. And then here are some harder asks. This is what they'll really be listening to. These are much more specific. Hard asks are things like, can you explain to us why Georgia has the lowest tobacco taxes in the nation when we have such huge unmet needs for substance abuse prevention and treatment that those taxes could fund? Are they willing to learn about how effective civil social host laws have been at the local level and consider the implications for the state of Georgia? Would they consider adjusting Georgia's tax on distilled spirits for inflation and using those funds for the state's substance abuse problems? For local communities, one of the harder asks is let's keep the power, let's keep making those decisions to opt out of hosting cannabis dispensaries, because just like alcohol, the more places there are to buy cannabis, the more people will use it. And then keep those space buffers in place between both alcohol and cannabis outlets and sensitive land uses. Give them a sense of your vision. What's the world you want to see? We want a world where alcohol, tobacco, and other drug use doesn't ruin lives, families, relationships, where young people are not subjected daily to sophisticated marketing messages encouraging them to use dangerous drugs, where the taxes on alcohol and tobacco are high enough both to discourage use and to pay for some of the damage. A world where we have choice about the businesses in our neighborhoods and what they sell, and where what we do about cannabis is guided by public health evidence and not a private profit motive. My ideal meeting with a policymaker is 4 people with 4 short, well-prepared practice presentations that lay out different aspects of the problem, that tell personal stories, that talk about what works to prevent, what happened in those stories, and then that finish with the ask, what you want the legislator to do. Now, what's critical about doing the best kind of meeting? It's the same answer as that old joke. What's the best way to get to Carnegie Hall? Practice, practice, practice. I want to end just by saying I have tremendous hope for what you all are doing. I like this quote from the Chinese poet and essayist Lin Yutang. Hope is like a road in the country. There was never a road, but when many people walk on it, that road comes into existence. What you are doing by advocacy is creating roads of hope, of possibility, of longer, healthier lives in vibrant communities for everyone. Just a reminder, advocacy is a year-round opportunity, a year-round activity. This is really a marathon, not a sprint. You want to have these meetings with policymakers and you want them to turn into relationships. You want to see them out in the community and take opportunities to talk to them again. You want to go back and see them. Like them, like us, like so many of us, they learn well by repetition. So my message of hope for you, we can raise awareness about the role of price in youth drinking and tobacco use. We can reduce the physical availability of alcohol and tobacco, especially to young people, and reduce young people's exposure to drug marketing. We can make adults responsible for the choices they make that affect our young people. We can maintain and strengthen effective drug control systems, shape tobacco and cannabis environments so they protect youth and other vulnerable populations, win allies, and make prevention work. Yes, the opposition can look like a big fish with so many of us we can make the difference. I offer you courage. I'm inspired by George O'Keeffe, the Southwestern artist who said, I've always been absolutely terrified every moment of my life, and I never let it keep me from doing a single thing I wanted to do. And of course, by Margaret Mead, who said, never doubt that a small group of thoughtful, committed citizens can change the world. My friend, you are those citizens. Have fun. Thanks for all you do.